Hello, everybody, and welcome back to another episode of the Doctor's Lounge with myself, Dr. Ahmad Alauddin, and as always, Dr. Sajad Ahmed. Hi, Dr. Sajad, how are you doing?
I'm all right, thank you. I'm very well. How are you doing?
Yeah, very good, very good. It's been a while since our last podcast with one commitment or another, but we'll be back more regularly from now on.
Yeah, it's been quite busy actually as well because with the way things have been going, it's been sort of a bit overwhelming at times, and we've been planning to sit together and just one thing comes up and another, and shifts are not matching up. So, but finally we're here.
Yeah, and I think actually that will bring us quite neatly onto our topic today, where we'll be talking a little bit about mental health, but not mental health in general, mental health and how it affects us as doctors in the medical profession. So a big topic that we're seeing generally at the moment due to COVID, but also exists anyway as a base level before the pandemic even started. So we'll explore a little bit and then try and share our own personal experiences of how we deal with mental health to try and give you maybe a little bit of pointers. Obviously, there's no right or wrong way. Everyone has their own way of managing and having coping mechanisms. But I think if you have shared experiences, you'll find the best way through a combination of things rather than just having to do it by yourself.
Yeah, I mean, you're completely right about mental health. There has been sort of a gradual build-up of discussion around mental health, especially medical professionals, over the past few years. I would say past few months is a bit more. Royal College has been sort of pushing it. BMA has been discussing it as well. And with the COVID-19 has sort of brought it really to the forefront. So, yeah, today's topic should be an interesting one. And I'll tell you what my experience is. But let's start with Imad first and see what he wants to cover.
Well, let's go a bit generally. As we know, doctors, we kind of very stressful lives. We can be very busy with our shifts. Patients can be complicated, difficult, sometimes demanding. And generally speaking, so even outside this whole pandemic situation, there is a lot of mental health within the medical profession. And now, us as doctors, I don't know about you, Dr. Sajad, but myself, I'm a terrible patient. I won't seek help. I won't do things that I should be doing. And if I was a patient and I saw myself as a patient, I'd be very cross with myself. I think this is but getting to the crux of the issue really is that us as doctors are very reluctant to seek help, especially when it comes to mental health. I think there's a lot of stigma that we still perceive is attached to doctors suffering with mental health and how they can try and manage in the stress environment that we do work in.
I think you're completely right. I mean, to be honest, I think, let me tell you about what basically happened to me. And that will probably give us a bit of context of what actually depression is. We know the symptoms of depression. You get those biological symptoms of, lack of concentration, appetite changes, and sleep disturbances. But unless you've actually been through it yourself, you don't really know what it actually feels like. And it's very close to what I would say bordering on burnout, which is another sort of a catchphrase being used quite often, especially when we're talking about doctors burning out. And I think, I mean, I've been through this whole sort of process of rigmarole of symptoms for the past couple of years now. And you tend to get these dips. And what I've noticed in myself is that, I mean, initially I started getting very, I thought was a burnout was I didn't want to go to work. I didn't want to see patients. I didn't want to get out of the house. I completely was very sluggish. I was overeating. I started putting on a lot of weight. I couldn't concentrate on work either. I couldn't concentrate on one thing. So if I'm watching TV, I would get distracted and get on something on the phone or start playing with the laptop, or, I just couldn't focus. And even doing those things, I wouldn't follow it on. I was somebody who was, used to read a lot of books, and I couldn't follow on books anymore. And my wife actually picked up on these symptoms with me, and I ended up going to the doctors and, getting treatment for that. But what I noticed was a lot of medical professionals actually don't know where to get help as well.
Yeah.
So, for example, in Wales, we have the Cardiff University program for counselling for healthcare professionals, which is funded by the Welsh government, which is there. In England, we've got the BMA, the RCGP as well, providing support. So there are links to those sort of services. A lot of cluster groups as well provide some sort of support. So there is help there. But I think in the way it affects us is that, I mean, if you're going into work at early in the morning and let's say you're a partner in a practice and you're seeing patients and you're dealing with staff sicknesses and you're dealing with paperwork coming up and blood results coming through and you're following patients and you've got house visits and you've got colleague sicknesses, you've got a lot of work to manage. You've got to manage bills. And if you're not finishing work at, let's say, 6:30, 7 o'clock in the evening, and sometimes you're taking work home, which is then affecting your family life and what you're doing at home, you haven't really got much time to do exercise. But the advice we're giving to patients is, go for a strenuous exercise or strenuous workout, because that's going to increase your serotonin levels. Try applying it yourself and you're going to know how practical it is. And now some people are very on the time. Some people are very focused. They've got very good timing and they're going for runs and all that sort of things. And but there are a few far between which are not. I mean, I'm not a runner. I've never been a runner. I've never been a gym person, but I do like walking. I do like hiking. And the way I managed it was actually I started thinking back about hobbies, what I liked doing in the past. And it suddenly came back to me a couple of years ago that actually I liked photography. And why haven't I done it since medical school? So I started actually physically pushing myself towards that. And now that's become a bit of a focus where I am planning time off specifically, which I'm looking forward to every 2 months, 6 weeks. I mean, the pandemic has had a bit of a dampening effect on that.
Yeah, so it's interesting what you were saying about finding time. So you're right, we always recommend, you do hobbies, get out exercise, find time for yourself. How did you actually overcome that challenge personally? How did you find that time to do the photography, to do the walking, to do the things that you loved again?
Very good point. I mean, so actually I sat down and I looked at my sessions, and at the time I was doing around 10 sessions, which is quite a lot. And sometimes I would do out of hours on top of that. I physically just stopped doing the sessions that I was doing. I just quit. I went down to part-time. And I freed up my time. Of course, it affected me financially, but mental health-wise, I think I was much, much better with that. And so as a result now, there are times, for example, COVID-19 had put a lot of pressure where initially there was no sort of work. And then suddenly the work, although picked up, it's become where for the 2 months or so, we were completely overworked, busy, patients starting on telephone consultations, face-to-face, and all things are sort of opening up. So, work got suddenly very busy. And so, for example, the last 4 or 5 weeks, I haven't been able to take any time off. But now, I knew that's going to happen. So I knew September would be a month for me where I would have my half days back up again. I will have my Fridays free. I'll have times. And now I've just been back after 3-4 days off. I'm planning for another 3-4 days off in next 2 weeks' time. So it's looking forward to these little chunks of time off, which helps you keep your sanity.
Of course, yeah. And obviously you mentioned the pandemic, and it seems like we always have to touch upon that at some point during our podcast. Of course, that's added a huge extra burden on things, and the situation has intensified and perhaps therefore exacerbating a lot of people's mental health issues, which you're seeing in the public anyway, but also with doctors as well. So the BMJ ran a survey quite recently, and I'll just read some of the quotes out actually, because they're really insightful into what's going on. So just I'm just read one or two. I feel like I've aged over the past 3 months with variable levels of anxiety and stress. It's been a roller coaster of emotions while trying to run a practice and protect my staff. There's another one here saying, the pandemic made me worry about myself, my husband, my children, my parents, my patient, my colleague, and business. My anxiety has been relentless and changed the way I work, my self-worth, and what I can provide for my patients. I feel there's no light anywhere and no relief. And last one I'll read, at times it felt completely relentless without an end in sight. The most traumatic part was the stress on the patients and even more so their relatives. So some of that reading is quite striking and
it takes home the point. Yeah, I think it takes home the point of mental health, because if you, I think the second or the third comment that you mentioned, it's affecting myself, family, business, parents. What do you do if you're running a surgery and you're running a business? What do you do? I mean, you can't really shut shop and say, I'm going to start having X amount of time off because it's stressing me out.
Yeah.
You can't find locums. If you find locums, they're not willing to do the same amount of work that you would probably do. The rates would be extortionate, as they sometimes put it. They're not going to be able to do face-to-face either because of personal own worries. They've got their own concerns. So I think there's a lot of, it's not just down to the government providing counseling. It's not just down to the government providing treatments and saying there's actually needs some support in the backlog. The furlough is all very good, but during all this time, the doctors weren't even getting PPE, let alone any other support being given to those suffering with mental health issues or those suffering with problems where practices may be needing support or local health boards stepping in. So I think it's not as simple. I think there has to be sort of a comprehensive policy where you're actually helping doctors out in difficult times and support them during that time. I've known a couple of GPs, quite well known, who have suffered with severe depression and ending up resigning from their jobs or taking early retirements because of that. Would they have taken early retirement if there was some sort of support available for them to carry on in a place with some support being given? That's, I don't know.
Yeah. Well, I think for me personally, during this whole pandemic period, there has been an increased workload. The stresses come from there, and obviously you're dealing with people who are worried, which then will transfer to you. But then, you are very worried about how it's going to affect you and your family and things. And especially my parents who live here, couldn't really see them because of the fear. You didn't want to pass anything that you may have picked up at work across to them. In addition to that, you're not really being able to go outside and do hobbies and things during the lockdown period or take time off, as you're saying. I think recently now people are starting to say, we're going to take a bit of time off to try and recuperate. But there wasn't a service in particular. I think there are services available, you're right, but there wasn't anything that set up at the time to manage the effects of COVID on mental health and how it's affecting doctors. I think that's starting now to come across as we see more people present with these issues now that things in the hospital and medical, well, I wouldn't say they're dying down in general practice, but there's less sort of COVID stuff now. It's more the more stuff that we were seeing before COVID now popping back up again.
Yeah.
But there are things you described as sort of the BMA BMA Wellbeing Service and the RCGB service. But really focusing on the COVID aspect of it, I think that's going to be the next thing that the people are going to work on. Because I think, especially for our hospital colleagues, there'll be a lot of post-traumatic stress almost after having to have worked in those situations. I think maybe in Wales we've not been too bad.
Yeah.
But in other parts of the country where they've had full hospitals, full ITUs, people dying on huge numbers on a daily basis, it's really going to have the toll on the doctors who have to see that firsthand.
Well, I think we've seen the video of one of the nurses who was in tears in a car parking
Yeah.
about what she felt like, and I mean, as primary care physicians, we didn't really get to see that from COVID. We had the odd patient coming in with the symptoms and initially not mentioning them on the phone,
Mm.
thinking that if we mention that we won't see them, which was of course we won't. We're going to try to divert that towards the hospital for review, and suddenly a panic would come in. Okay, I now need to I need to glove up, I need to scrub up
Yeah.
before I actually see this patient or
Mm.
after seeing this patient. So those sort of things have happened, and they've caused a lot of fear. And you mentioned about not being able to see parents. I mean, a lot of doctors talk about that. And to be honest, I mean, my mum is in Pakistan. For
Mm.
me, I haven't seen her for nearly 2 years now. I saw her in February 2019. And, since I was planning to go beginning of the year, and then suddenly COVID happens. So I haven't been. And now you've got the second wave coming. So I'm still a bit worried,
Mm.
because then there's the quarantine rules as well, especially in Pakistan and here. So when I go, I have to quarantine, and then when I come out, I have to quarantine
That's
because
the
am I
week right
taking you
there.
with me? Yeah, so it's a worry. Um, and to top it all off, I mean, the Home Office is in a complete rubbish because they won't grant visa to
Mm.
parents to actually come and visit, which is, so as we talk about depression and we talk about stresses and we talk about how these things affect us. When you've got so much things going on in life, how do you actually go on enjoying? I mean, that's what's called
Mm.
life, I guess, at the end of the day. So
Mm.
yeah, there's a lot of things that happen, and ways of dealing with it, I think, is very, very important, and how we
Yeah.
actually manage it. Things are going to carry on happening, aren't they? So
And of course, I don't think the mental health problems will die away as COVID starts to settle. I think you'll still see the lasting effects of what's happened and what we've experienced for some years to come. So, for example, people who worked in the aftermath of the Chernobyl disaster, people who were working during SARS, people who volunteered for Ebola, all these people have shown mental health issues for some years afterwards. I think the important thing is, as you said, and what's going to be useful for people listening and watching is where they can find help. And I think we touched upon a few things earlier on. I think it's probably worthwhile going into a bit more detail about how we can access things. Obviously, there are things we mentioned like the BMA Wellbeing Support Services. There's a service called Doc Health, which is another service you can go on to. There's the Doctor Support Network. And I think in Wales, you said there's the RCGP mental health thing. So how do you, obviously, I think
in
you've
in,
probably had more experience there. How do you actually go about and access those?
in Wales, you have got the Cardiff University
Oh, yeah, that's right.
um, health. I think it's called Health for Healthcare Professionals.
Okay, yeah.
So even if you Google that, there's a website with a phone number,
Yeah.
and it's completely anonymous. So they go on first name basis, so they don't even know who you actually are, and then they'll pay you with a counselor. So
Yeah.
your history is taken by a GP who doesn't know you, and once you've been paid, you can then book appointments, and that's being paid for by Cardiff University
Mm.
through the Welsh government. So their service is there, and then that can carry on, but it's sort of a stepping stone,
Mm.
really, in recognizing in CBT and those sort of things.
Yeah. Okay. See, I think it's quite useful the anonymity of it because that's as you were saying, as we were saying before, the stigma attached to
Yes.
mental health obviously sometimes leads to people not accessing the help that they need. So having that knowledge that you're not going to be judged or you're not going to be speaking to someone who perhaps you would know who's running a service.
Exactly. I
Is
mean, the way I work when I rung up, I was mentioning my name, so they just said we only need your first name,
mm,
because surname can, sort of potentially can be identified as Doctor so and so,
yeah,
and I basically just gave a bit of my history, and the doctor I spoke to agreed. They thought I was suffering with depression and suggested that we should get some, counseling, etc., things like that, and obviously trying to get the red flags out of the way, that sort of thing. And then, a couple of sessions, but it's something to help you teach cognitive behavioral therapy. There's things like NLP. A lot of people do, neuro-linguistic programming. I haven't had any experience in that, but some of the colleagues I know have actually done that. So there are things out there and support out there. And I mean, but what I'm trying to say is that, while the support like that is out there, we don't really have support which should be given behind the scenes to work patterns or to businesses while patients or doctors are suffering with this. So, just an example, a single-handed practice, GP suffering with depression, what support is there? When are they not getting help, Yet single-handed practices are probably not as common as they were before. But let's say you've got two partners, one is part-time, one is full-time. And one of them suffers with depression, or three partners. So how do you support that business as well with the lack of it? I mean, there is things like going off sick and sick pay and all that, but a lot of times that's not enough, especially in the context of COVID, of how things have been working as well. So, I mean, primary care is being dumped a lot with the secondary care work. I mean, we can go on and talk about that, but I think it's a bit...
I think a lot of practices have taken it on themselves, not had much support, you're saying, from the government or the Welsh government, etc. There's the practice I work in, for example, have buddied up with the practice next door, and they say, okay, and the one next door, I think, is practically single-handed. They have one full-time doctor and one part-time doctor. And they said, the practice I work in hasn't got many doctors, it's a relatively small practice as well. So they said, well, if something happens to either of us, we'll try and cross-cover if we need to. Touch wood, nothing like that has happened yet. But I think there are practices who are taking their own initiative to try and safeguard their patients and their practice lists by coupling up or having cluster working. So there's a group of practices that sort of will work together and try and get through the whole situation together. And some of that, I think the cluster working has been pushed by primary care. But the sort of other aspect of it, I think it's more the GPs and the doctors themselves thinking, do you know what, how can we try and find a solution to all this?
Yeah.
A couple of free things I wanted to mention as well. You mentioned things like neuro-linguistic programming. Yeah, and just one other thing is there's lots of apps and free resources that you can use on your phone now. Everyone's got smartphones. You can download apps for digital CBT. There's an app called Calm Harm, that's very good. And also the big thing at the moment is mindfulness. And there's a great app called Headspace. Again, both these apps are free on both Android and Apple. So they're quite a good resource if you don't think you have time or you don't want to speak to somebody else about the issues that you're going through. You can actually try and help with self-help, either with websites, or these apps are very good as well. And these are some things I recommend to patients as well as colleagues. So there are resources out there. It's just about being comfortable enough to access them, to get the help, and recognizing when you need help. Like you were saying before, often it's not yourself who thinks, oh, I need the help. It's either a loved one or a colleague says, listen, you need to seek help, perhaps because you're showing some signs of burning out, some signs of stress, depression, anxiety, whichever one it is.
Yeah. So it was a good one today. Hopefully we learned something. Next one, we're probably going to be talking about locum work.
Yeah, I think we've got a special guest coming in for the next one, and then it's quite a big topic, isn't it? So I think we might end up doing
split it to
two-parter, but that will be very interesting, especially with what's happening at the moment in Wales.
Especially locum work and GP partnerships.
So hopefully catch us next time again on the Doctor's Lounge. We'll see you then. Take care.